Hi, my name is Erin Phillips, and on behalf of myself and my co-authors, Drs. Jason Coe, Shauna Blois, and Elizabeth Stone, I will be presenting this video manuscript where we are going to introduce you to a client communication tool called the Talking Physical Exam. The Talking Physical Exam is a tool that's been informed by the Calgary-Cambridge Guide and by previous research at the Ontario Veterinary College. The concept behind the talking physical exam is verbally describing what is being examined on a patient and relaying normal and abnormal exam findings to veterinary clients while the veterinary professional conducts the companion animal physical exam. In support of our ongoing research into client communication surrounding the physical exam, we created a video tutorial to demonstrate the use of the talking physical exam in clinical practice. We wanted to take this opportunity to put our tutorial into a video manuscript format to share with the broader veterinary profession, as we feel the talking physical exam is a practical tool that can assist veterinary professionals with engaging clients and has the potential to increase the value of the companion animal physical exam for clients in clinical practice. Previous research has identified a communication gap between owners and veterinarians about the physical exam, specifically in areas such as owners' identification of whether an exam was offered as a service at veterinary clinics, owners' awareness of what aspects of their pet was being examined during an appointment, and the lack of communication to owners around the value of the companion animal physical exam. In a study surveying 1,400 veterinary clients, a low percentage of clients, 8% of dog owners and 7% of cat owners, identified that an examination was a service provided during a veterinary visit. A potential reason for this poor client understanding of the physical exam as a veterinary service offered was that veterinarians may not be making clients aware that an examination is being conducted. In another study surveying 2,188 veterinary clients, 63% of dog owners and 68% of cat owners saw no need for an annual examination. This finding was offered as a reason for why owners were not taking their pet to a veterinarian more often and suggests that veterinary clients may not be seeing the value of routine physical examinations for their pets. To address concerns related to owners' awareness of the performance of and the value of the companion animal physical exam, a client communication tool called the Talking Physical Exam was developed for use by veterinary professionals. The idea of explaining the process and finding of a physical exam has been identified in human medicine as a clinical communication tool in the Calgary-Cambridge Guide. In veterinary medicine, the concept of the talking physical exam has been recently defined as verbally describing what is being examined on a patient and relaying normal and abnormal findings to a veterinary client in real time while conducting the companion animal physical exam. Previous research by DaCosta et al. In 2022 used 376 recorded veterinary client-patient interactions involving 60 veterinarians to assess veterinarians' use of a variety of communication-related parameters surrounding the companion animal physical exam. This work found that veterinarians verbalized to clients, on average, 56% of their physical exam performed on a patient, which suggests that the talking physical exam is currently being underutilized in clinical practice. The present video tutorial demonstrates the talking physical exam as a communication tool veterinary professionals could use routinely in clinical practice. All right, we're getting started on our exam. So I'm just taking a look at Maggie and I'm assessing her body condition score. So I can see she's got a nice tuck of her belly and a little bit of fat covered over to her ribs. So I would give her a body condition score of 5 out of 9, which means she's in an ideal body weight. I also can tell based on her weight from last year, she stayed the same this year, about 7.2 kilograms, which tells me you're doing a good job of keeping her weight stable as well. And then looking at her, I can see she's got nice muscling on her back as well as on her back leg, so I would say she has a normal muscle condition score as well. We're going to move on to her head. Hello, Miss Maggie. I'm just going to have a look at her. And I want to have a look in her ears. If you don't mind just holding her head. I'm going to have a look down inside. What a good girl, Maggie. Very good girl. Okay. Perfect. All right. So I'm seeing a little bit of debris deep down in her ear, but I'm not seeing any signs of infection, so no redness or any irritation. Her tympanic membrane deep inside her ear looks completely normal, so no signs of infection there. I'm just having a look at her eyes. I don't see any redness or any debris, and there's no cloudiness of the lens. Everything looks good there. I'm going to have a look at her mouth. Yeah, looks nice. Okay. I'm looking at her teeth. So I can see that she does have a little bit of tartar. If you want to have a look, you can see a little bit of tartar along her gum line, on the back here as well. So no gingivitis, no broken teeth, but a little bit of tartar.
I can see the tartar, yeah.
Okay, perfect. All right. Right down. Girl. Yes, very good. Okay, so I'm going to check out her lymph nodes. So they're feeling really nice and small and symmetrical, which is exactly what I want to feel. In certain cancers or infection, her lymph nodes could get enlarged, but I'm not seeing any signs of that here.
Okay.
Right. I'm going to move and have a listen to her heart and her lungs. Girl. Go. Excellent. Good girl, Maggie. Yeah. All right, so great news is her heart rhythm is completely normal, so no signs of any arrhythmia. Her rate is exactly where I would expect it to be for a dog of her size, and I don't hear any heart murmurs, so that is great. Her heart sounds good. Listening to her lungs, I don't hear any abnormal lung sounds, and she has a normal respiratory rate and effort. So for the heart and lungs, everything is looking good.
Great.
All right.
Get her back up.
Yeah, I'm just going to have a feel of her belly now. So she's a little bit tense, which is often, what we find when we're palpating their abdomen. But I'm not feeling any signs of discomfort, which is good. I'm just having a palpation here. I'm not feeling any enlargement of any of her organs or any obvious masses or abnormalities in her abdomen. So that's all a good sign as well. Girl. All right. Just having a look at her vulva. Everything looks normal there. And everything looks good on the outside of her bum too. Now I'm going to do a quick rectal exam on her. Okay. So if you can just put your hand under her
underneath like this?
belly there. Yep, that's perfect. And we'll be very quick, Miss Maggie. Good girl. Excellent. What a good girl. I'm just having a feel in here. Her anal glands feel totally normal, so they're nice and small. I'm not feeling any masses or anything. So all looks good there.
That's good.
Good girl, Maggie. Very good. Okay, perfect. I know, what a good girl. All right, so just gonna have a look at her coat now. So I can see that her coat looks nice and shiny. She doesn't have any dandruff, and her skin is looking really healthy. So I'm not seeing signs of any irritation of her skin, any hair loss, or any redness, which is perfect there. And then I'm just gonna have a feel for any masses or lumps or bumps that shouldn't be there. Girl. Excellent. Feel here. Good girl. Perfect. And then I want to have a quick look at her paws. I know she doesn't love this, so we'll see how she does. Oh, what a good girl. Go. Excellent. So no redness or anything. Oh, what a good girl. Very good. You were very brave for that. Okay. And just finishing up the last part of my exam, I'm going to have a look at her legs. Okay. So I'm going to start with the front legs. Just feeling all her toes. Feeling her joints as well. And seeing that range of motion. Perfect. And the other one. Good girl. Very good. Okay. And once again, she's not giving me any indication that she has any discomfort in any of the joints in her front legs or bones in her front legs. Those feel good. We're going to do the same on the back. Good girl. All right. Everything is looking good. And you haven't noticed any limping or anything with her?
No, she's been okay.
Good. Excellent. Okay. Perfect. Everything is feeling good. No swelling or discomfort on her back legs as well. So I think her legs are looking good. And with that, we're all finished our exam. She did really well.
Oh, thanks, doctor. Good girl, man.
Good girl. The talking physical exam has strong clinical relevance as a client communication tool, as it enhances clients' awareness that a physical exam is being performed, it supports client engagement in their pet's health, and it has the potential to increase clients' understanding of the value of the companion animal physical exam. The video tutorial we created is a practical tool that can guide veterinary professionals on the use of the talking physical exam in clinical practice. We hope this video manuscript has been helpful in introducing you to the talking physical exam and look forward to how you might apply it in your own context in veterinary practice. We'd be very open to receiving your questions or feedback on the talking physical exam through our lab's website, which is www.rcvm.uoguelph.ca.